Welcome to another edition of Black Health Now. Today, we are gathered to have a live conversation about mental health in the Black community. With an acknowledgement of September, which just passed, being Suicide Prevention Month, which we want to raise awareness of because suicide is one of the worst outcomes tied to unaddressed mental health issues and is unfortunately on the rise in the Black community. My name is Veronica Warman. I am an SVP Group Creative Director at Entree Health, which is an advertising agency focused on market access. And we work with manufacturers to help patients get access to the healthcare that they need. And I am incredibly honored to be joined today by three panelists who we will speak to in one moment. But just a quick overview, we first have Billy Edwards, a youth case manager. We also have Teresa Wilson Martin, a family psychiatric and mental health nurse practitioner. And our third panelist is Michelle Ziegler from Archbow. She is a director at Archbow Consulting and worked very closely with me in organizing this discussion. Thank you all so much for being here today. So in a moment, I will ask each of the panelists to do a personal introduction, but first we'd like to start by setting the stage for why today's topic is so important. So I'm going to share some slides and invite you to think about these staggering statistics during the conversation in hopes that we can spark ideas to help improve these statistics within the Black community. So the first concept we wanted to introduce is just this idea of cultural and societal expectations. And when I think of this, the first thing that comes into mind is the strong Black woman trope. These kinds of ideas can really prevent Black people from seeking help when struggling with mental health. The second statistic is the fact that 65% of Black adolescents have experienced one or more traumatic events in their youth. And the last is Black people are 20% more likely to experience serious mental health issues, such as depression and anxiety, than the general population. So all of those things to say, there is a real need to have these kinds of conversations. And we really are so excited to be able to bring to you this powerful discussion panel. So thank you again for coming and being here to share your expertise with us and to help the audience understand why we've brought this group together for this conversation. I'd like to start by asking each of you to tell us a little bit about the personal journey that led you to be with us today. So I'm going to first ask Billy, can you share your journey with us?
Absolutely. Good morning, good afternoon, good evening, good everything to wherever you are in the world watching this recording on today. My name is Billy Edwards. I am originally from Chattanooga, Tennessee, but I have lived in Nashville for a few years, we'll say. What brought me to the city was college. I am a graduate of the Tennessee State University here in Nashville, Tennessee, where I received my bachelor's degree. I received my master's degree from Cumberland University. I began my career in social work and of public service through a state agency here in the state, working with children who were in the foster care system. I currently work with a city social work agency working with young people who are a part of the judicial system from a juvenile perspective. So that wasn't the plan. The plan was law school, but the calling was public service. So eventually, of course, I surrendered to that. And so that has been my journey, just of public service to children, youth, and their families. What brought me to this call today was Michelle asked. And so I said yes. She has always been encouraging to me for the work that I do. She was very passionate about this project and about my expertise, and I felt like she trusted me to be here. So I'll be grateful to her for the opportunity always to have this conversation, especially with two other ladies that are such experts in their field as well. So that's why I'm here today, and it's a pleasure. So thank you.
Thank you so much, Billy, and thank you for the important work that you do. Teresa, can you talk to us about your journey?
Absolutely. First, I want to say this is a topic that I am very passionate about. So I am glad that we are having this discussion. Um, we couldn't have this discussion enough in my mind. But my name is Teresa Wilson Martin. I am a board certified Tennessee licensed family psychiatric and mental health nurse practitioner. What that means in short is that I see children starting at age 6, adolescents, and adults. My oldest patient currently is, I believe, 97 years old and thriving. Um, my professional journey has been very exciting to me. I have had the opportunity to work with people that have chronic, persistent mental illness. I've had an opportunity to work in the community mental health sector. I've had an opportunity to work with those that have dual diagnosis and substance abuse. Um, and I've seen a little bit of everything. I believe I've worked inpatient and outpatient as well. This discussion is in part important to me because in 2018, when I established my practice privately, part of that catalyst was simply, in my opinion, seeing that it was difficult. It is difficult for African American people to access mental health service. There's a combination of inadequate resources, and I saw a need, and so I'm delighted to be a part of this discussion. I'm here as well because Michelle invited me. Um, and I said yes because she was passionate about it. I could hear it in her voice. And so I believe that we're on the right path by just even broaching this topic. So thank you all for having me.
Thank you so much, Teresa. We appreciate you. So, Michelle, tell us about your journey.
Hello, my name is Michelle Ziegler, and I am a director at Archbow Consulting. At Archbow, we help manufacturers optimize their strategy in the market, and we are under Omnicom, which that's how I met Veronica. I'm here because Veronica asked me. Everybody wanted to say that, but what brings this passion to me is that is the journey that I have been on for a few years. I am a proud alumni of Middle Tennessee State University in Murfreesboro, Tennessee, and I'm a recent graduate. So a graduate of the class of 2022, and that would not have been possible had I not taken my fear and pushed it to the side to address the learning disabilities, my anxiety, bouts with depression, all of those things, and being able to say, no, this isn't normal. This isn't something that I should continue to do it, because doing it all on my own over and over, I was doing the same thing, expecting a different result. And anxiety, right? Or insanity, right? So doing those things over and over and expecting a different result, it wasn't working. And so I decided to try something that I was very fearful of, and that was go have some help, talk to a therapist, psychiatrist, understand why the comprehension wasn't there when you're reading, understanding why it takes you from 10 to 100 when the change was there. And once I was able to identify those things with the help of a medical therapist, then what happened was my journey just transformed. I was able to finish college, my career progressed, and I became the person that I've always wanted to be. I just didn't have that. It was just that neural type of connection that was not making it. But with that help, medication, constant therapy, I am who I am today. And I'm very proud to be here and to share my journey, because there are many people who are walking those same shoes and are pushing it to the side. But there is a way that we can progress as a community, as the Black race, once we decide to push away those fears and get the proper assistance that we need. Thank you so much for volunteering me for this discussion, Veronica.
It was an invitation. It was just a very convincing one. That's all.
It was.
So,
It was.
thank you so much for sharing your journey and being so brave, because those are hard things to admit out loud, but obviously incredibly important, and just look at the outcome.
Yeah.
So with that said, today's discussion is clearly giving perspectives on the mental health and the Black community from 3 different but equally entrenched perspectives: an advocacy perspective, a social work perspective, and a mental health care perspective. So now we are going to dig into the good stuff, and we are going to start asking these ladies some questions. And the first one is starting with the misconceptions about mental health. So data tells us that 63% of Black people believe that mental health illness is personal weakness rather than a medical condition. What are some other common misconceptions about mental health in the Black communities that you ladies have come to know? Teresa, would you like to go first?
Absolutely. Well, from a mental health provider perspective, when I'm working with individuals in the Black community, some of the things that I've encountered regularly is people questioning, is mental illness really a thing? Is it even a real thing? Is it an illness, or is it a lack of faith? Is there a misconception or sometimes a connection that what people are experiencing has something to do with faith? That is a misconception. There's a misconception that if I take any type of mental health medication, that's going to permanently alter my brain in some way and change the person that I am, or have me robotic in nature in some way. So it's very fearful, but that's a misconception about the treatment of mental health.
Billy, what have you encountered?
My work with adolescent teens and with their parents, I've encountered things such as, I ain't crazy. I'm not going to go up there and tell them white folks all my business. There's nothing wrong with me. That's not what Black people do. And those sayings or those myths have been very harmful to families and young people really getting the help that they need. And I think because that is an overall fear of not really knowing what mental health treatment is. I think that social media and television and the world of Hollywood play into it as well by not giving a clear and accurate picture of what mental health care really looks like for a person, especially for some of our young people. So those are just a few of some of the misconceptions that I've heard.
And what about you, Michelle?
I think there's a clear delineation between some of the generations. Like my daughter, she's a Gen Z, and they are really open now. It's one of those things, it's like, go see a therapist. I love that. Now, my parents, who are baby boomers, there's one thing, maybe talking to someone is okay. But if you're saying you're on medication, it's like, it's like,
right. Yes,
that takes it up a notch, right?
Yeah, it's one of those things. It's like, well, what's wrong with her? That generation is just really just uneducated of how just the psychological aspects affect us in our day-to-day, and the things that we are capable of should we get some of these identify some of the areas that are not connecting. But I feel like, if you say, hey, I've been seeing a psychiatrist and I addressed all of this. Now, psychiatrist is really going to take them over the edge. You know what I mean? It's like you are probably one step away from being wrapped up in a white coat. So it's just, I think that's it. Especially from my perspective, I would say the different generations and the thoughts behind those generations, because me being a Gen X, that's still something that we were taught from the baby boomers, hey, we're strong, we survive. I hear this from a family member. We've survived slavery, we survived segregation, we got it, and I'm like, yeah, we have trauma.
Right, right.
We have trauma.
Absolutely.
And we have trauma that needs to be addressed, so
Absolutely.
that we are able to be in really great relationships and work in groups of people of all different nationalities and social backgrounds, so that we're able to do those effectively. So yeah, I think it changes from generation to generation.
Yeah. And it is so encouraging to see those cycles start to get broken, right? Because it's so clear the impact from one to the next. The boomers being who they are, Gen X being like kind of left to our own devices. That's not always good. That's not always good. So, Michelle, just talking to you for a moment, can you share any personal experience with a misconception and how it was overcome?
I think just being an example of it, the misconception that, I like what Teresa said, it'll alter who you are. I have some people are like, yeah, I don't like the way it made me feel. Well, maybe that wasn't the right medication for you. Don't just give up and say, oh, this isn't for me. There are other, there are options out there. So I think as it took me a while to be really vulnerable enough to share my journey, but then it hit me why. Because if you look at the person I was, 6-7 years ago, and I couldn't present in front of a crowd. I mean, or in a crowd could be 10 people. If all eyes were on me, my anxiety was so high and my voice would change, and it was all of that. But once I was able to get the proper treatment that I needed, I was able to do those things. So I think those misconceptions that are out there, you really can't break them, but by saying, oh, you think that is how it works? No, it's not. Look, I've walked those shoes, and this is who I am, and this is what I have been able to accomplish over the last 3 years. How quick is that? That, and my journey isn't everyone else's journey. I was very fortunate to have an amazing therapist along with an amazing PCP, because it was something else. It was like, hold on, this is making her blood pressure go up. Wait, this is making her, it was back and forth. But working together, we were able to get me on the right track. It may take someone else longer, but it's staying the course and then being able to reap the rewards. I think overall, that's the way we just break those stigmas of showing the rewards at the end.
Yeah. And I think trying more than one thing, like what in life is so easy as just, I'm going to do this one thing and it's going to fix it all.
Right.
It's an unrealistic expectation just because it's there that it's going to be the right thing.
Right.
Billy, what about you? Do you have an experience with a misconception and seeing it be overcome?
Absolutely, professionally and for my own personal journey with therapy. So professionally, I have been taking young people and sometimes even their parents to therapy sessions, and them being so fearful of it, asking me, well, Ms. Edwards, what is this going to be like? Or Ms. Billy, what are they going to do to me when I get in that room? And the best way I could describe it was that you're just going to sit down and have a conversation with this man. You may not want to talk the first session, or you might. But the thought is for you to continue to try this until you start to open up about some things that are going on the inside that we can better deal with. So that was what I did for 12 years. That was my answer. That was the scenario. But then when it was my turn, it was different. So to put the multi-generational piece or the elders into the conversation, as Michelle just did, I lost both of my parents by the age of 34, in a 2-year time span. And my uncle, who is a part of the baby boomer generation as well, said to me, "Hey, niece, I don't know what that's like." I had decades between the loss of both of my parents, which are your grandparents, but I feel like you might need to go talk to somebody. And so for me, I became on the other side of the fence thinking, what are they going to do to me? What is that gonna look like? I had forgotten everything that I had told young people, everything that I had told parents. And so I had to remind myself that this is something that you're gonna do to be able to process some things that are going on the inside that we need to fix, that are affecting some things in your life that are external on the outside. So that first therapy session, I didn't want to talk. I just sat and cried, and that was okay. We discussed medication. I didn't want to do that. We put that on the back burner for later. So I think as a Black community, we do have a lot of misconceptions as to what's going on the other side of that door once you enter that therapist office space. And it's just a conversation, y'all. That's all it is. And you can have it or not have it, and that's okay. And if you pick a therapist that works for you, that you're comfortable with, the hope is that you will begin to open up and have conversation and be able to unpack some things, as we say in the therapeutic world, that you don't need anymore, that you may or may not be carrying, and you don't even realize it. That's what it was for me. I was carrying a lot of things that weren't meant for me to carry. So that was my personal therapy journey and my professional therapy journey. And I don't regret it. It helped me be a better person.
Billy, it reminds me, I'm like, do you think you're going to get connected to some probes or something? I mean, that's kind of it, right?
Yeah,
That's
I think that,
what some
yeah,
people think. What's going to be stuck to my head and what is the
exactly,
machine going to say? Yeah.
exactly. And I think that that's why the world of entertainment does have, or we need to place a certain level on accountability on them for what they do show people, because that's not what happens to you in a therapeutic setting.
Right.
The room is very nice, y'all. The couch is very comfortable. There are also chairs, so it's not like the show Frasier where you're just constantly laying on this couch with your hands on your chest, confessing all of your sins. It's not like that. You can sit on the floor. You can sit in a chair. Some therapists have beanbag chairs. If you're still able to get down there on the floor, you can do that. Play therapy for younger children between the ages of 5 and 10. Folks are professionally trained. Some therapists will take you for a walk around their office space. There are so many other things for therapeutic health outside of what you see on television. All you have to do is ask. It is your treatment plan. So if going for a walk, just say, "Hey, doc, can we go walk around the parking lot? I could talk to you better that way." They should be willing to do that. If they're not, then you probably need a different therapist. But it's not what you see on TV.
Yeah, incredibly validating. Again, like one therapist, that person might not be the one. You can talk to multiple before you decide to like really entrench yourself and take that journey with them. So make sure that it feels right, because it should be somewhat of a symbiotic relationship, right? Like not completely, you're not there for a lecture, so to speak.
Right.
Teresa, what about you? Do you have any example of a misconception and how it was overcome?
Well, I think the things that Billy, I chuckle as I'm listening to it, sitting in my office as a clinician. But all of those things are true. When people come and, I still have in-person visits, even though I do work virtually, but I still enjoy in-person. And it's amazing. I can see the fear on the face of people when they come in. And so I consider it a success each time a person pushes that fear aside and they come in, but when they choose where they're going to sit, we walk around and we just
Mhm.
talk about what they need, just in terms of comfort, that
Mhm.
sigh of relief, just like, oh my goodness. And and sometimes we talk about it, and because I want to know what were you expecting, and they were expecting, if they said certain things, somebody was on the other side of that door was about to come and wrap them up and take them,
Mhm.
out the door. So I
Mhm.
those feelings are real. Those
Mhm.
feelings are real to individuals. So I consider it a success each time a person just even takes the initial step to come.
Mhm.
But I love it even more when I see that, oh, okay, you know, there's nothing lurking around. There's not
Right.
anything, in here, and that comfort level, because I know that we can then begin the journey.
Mhm.
That's right.
We can begin that journey.
That's wonderful. And leads very nicely to the next topic. So, an important misconception to unpack is the belief that talk therapy and medication management are not distinct methods of treatment. Can you please speak on that, Teresa?
Absolutely. I think that the roots of that misconception, as Michelle was talking about earlier, I think that that is one that insidiously has plagued the Black community, in terms of, okay, if we go talk to somebody, or I don't want anybody messing with my brain.
Mhm.
And so I think it is important for people to know that talk therapy is an evidence-based clinical
Mhm.
practice, where sometimes you're just coming in and you're talking, just doing some cognitive behavior therapy. There's some other talk therapy modalities for people that have trauma. They may want to do some talk therapy that also includes, like, EMDR, for instance. But though none of those um, treatments require medication. Medication management, however, um, sometimes is coupled with therapy. I tell patients it doesn't have to be either or, it doesn't have to be both and. Each individual is simply that, an individual.
Mhm.
But I do think it takes the initial discussion, whether it be with a primary care provider, a therapist. I get a lot of referrals from therapists, even though I do therapy, because they're like, this person, I think, at least needs to be evaluated to see if there's some medication that's needed. So I think it's important for our Black community to know that just because you're going to talk to somebody, it doesn't
Mhm.
necessarily mean that you're going to need some medication. But if you do need some medication, that doesn't negate the fact that that you don't need to talk. And it doesn't mean that, like Michelle was saying, like, oh my goodness, okay, it's okay for you to talk to somebody, but now you're taking some medicine, you've crossed the line. And so I think it's important that we know the difference. I think it's important that we begin to have discussions just in general about the fact that the brain is an organ. And just like we're talking about high blood pressure and diabetes, which most Black people, I feel like, can readily relate to, I connect that to the brain. Just like other organs can malfunction and we need to readily address them, the
Mhm.
brain is no different. And so I think if we begin to have just some realistic dialogues where people are understanding the whole holistic part of the parts of our body and what's going on, not just our hormones, not just the heart, not just but understanding that, I I would like to think we're well on our way to breaking some of these misconceptions, and more people in our community actually saying, "Okay, Michelle, what did you do? Teresa, what happened with you? Like, what's going? Sometimes life just pushes you there where you like, let me ask somebody. I have to do something different."
Yes. Yeah.
Mhm.
And Billy, when we talked before, you had a great analogy with regard to the difference between medication therapy and talk therapy. Can you please share that again?
Well, if I remember correctly, I think I referred to the brain as being a muscle.
Hmm.
Yes.
Yes.
And so when you hurt yourself playing a sport, playing football, basketball, soccer, whatever your thing may be, you go to the doctor and you get that checked out. You just don't say, oh, well, it's just, I just rolled my ankle. It'll be all right. It's not like I really need it. I can push through. You know, we survived Jim Crow. I can push through. We survived summer 2020. I'll be all right. And you walking around here limping and broke down because you didn't go see about yourself, as my daddy would say. You go see about yourself. And so since then, another example I heard, for those of us that are cooks, that pressure cooker. Ooh, that was a tongue twister. The pressure cooker. If you don't release that valve and let some of that steam out, that thing might explode. And that's you up here and in here.
Right.
And if you don't go and talk to somebody, or if you need the medication, take it regularly so that your body can adjust to it, and then we can adjust it if we need to. It's not going to get any better. You're going to explode. You know, your whole ankle might fall off. I don't know. I'm not a doctor. That's not my thing. But you should go see someone, a professional, your PCP. You should seek out a therapist, you know, that can help you manage and deal with that, because you wouldn't just avoid it, you know, if it was a physical injury. And the brain is still a muscle. We don't recognize it as that. We take it for granted on a daily basis because we don't see it like we see our toe when we stub it on the corner of the bed. We don't see it, but it's still a muscle. And that issue still has to be addressed. It still needs to be cared for. It still needs to be nurtured. It needs to be healthy so that you can continue to thrive and live a good life. You're still going to have challenges, but therapy will give you tools as to how to manage those moments of crises, breathing exercises, affirmations, things of that nature. And then just your regular therapy appointment where you can just get all of that out. For me, talk therapy was extremely helpful. My therapist learned me so well, she would just sit and just let me just go. And once I cried, I would cry. She learned not to give me tissue, because if she gave me tissue, I would turn it off and I would stop.
Wow.
And I would get out what I needed to get out.
Mhm.
And so she purposely stopped giving me tissue. And one day she asked me if I noticed that. And I was like, no. She said, I don't want you to think I'm being cruel. She said, but when I give it to you, you stop. And you need to get that out. She said, so I stopped handing you tissue. And I looked around, and sure enough, the tissue boxes, they were no longer in reach. But I understood why she did that. And had I not gone through therapy, I wouldn't know that. So now, even for myself, I just sit and I just cried, and I'll go clean my face up later. But I wouldn't have known that about me if I hadn't gone to therapy.
What a great experience. That's amazing. And that's what it should be, right? Like,
Absolutely.
they're picking up not just on what you're saying, but how you're behaving and how you're responding. Michelle, what about you from a first person perspective on the other side of it?
On the other side of it, I am just, I mean, I think it's the gratitude that you have, because you have to, when you decide that you're going to go into it, you are, at the end of the day, you have to be okay with saying that you're not okay.
Absolutely.
And
Absolutely.
you have to be vulnerable to say that. You know, when I wanted to address some of my educational issues, I had the perception that I was a below average student all through high school. And then when I went into college, I did not see the end result. I didn't see, when I went into college, I couldn't see a graduation date because I didn't think that I was going to make it there as a teenager. And so as I look where I was and having to just say, hey, I mean, who is 40 plus and haven't read all the way through a book? You know, who can actually admit that? That is embarrassing, but it's also the fact that you know now that it wasn't because you were lazy. It wasn't because you weren't studying hard enough. It wasn't because you weren't applying yourself. It's
Mhm.
because when you got in that book, you didn't understand what you had just read. You gave up and you got,
Mhm.
it was like, why am I
Right.
spending 2 hours trying to read?
Mhm.
So when you identify those things and you're able to say, okay,
Mhm.
and these are the steps that's going to get you there, and these are the steps that's going to make you successful, it's refreshing. But the thing is, you have to push past that fear and tell what starts off as a stranger, look here,
Mhm.
I mean, I'm gonna see what you can do for me, but at the end of the day, I'm just a below standard person, below average person. And then you're like, oh, I'm not,
Yeah.
I'm not.
Yeah.
Like that that right there. It is being on the other side of the thing and looking from where I was. It's just you just want to shout it from the rooftop. And then when you start identifying other people, I'm not a therapist. I'm not gonna try and diagnose you, but I'm I'm also more compassionate
Mhm.
for people.
Mhm.
When you're talking to someone whose talk track may be all
Mhm.
over the place, and it's like, okay, they have some, this, I
Mhm.
feel as if they may have some anxiety, or, they're unable to put this in the correct order. So let me just take a pause and then ask. So you
Mhm.
find yourself being more compassionate when you recognize some of those characteristics that you've shown in the past. I think
Mhm.
that's something else that really I'm it's hard for me to say that I'm proud of myself, but I'm proud that I can
Mhm.
identify that, and I'm just not like that person over there ain't got it together. You know what I mean? It's
Mhm.
like, well,
Mhm.
there may be a reason why, and
Right.
let's work with them instead
Right.
of just brushing them to the side.
I think it's
Absolutely.
wonderful that you feel and recognize and proud is a good word for that, because so often, and you guys know this in the Black community, Black people are good at discovering something, but then they just want to keep it to themselves.
Mhm.
So the fact that, each one of us personally and professionally can reach one, and we can recognize
Mhm.
symptoms that other people may not know. You don't have to be a clinician. Um, you don't have to figure out what we want to call it, to just walk along somebody and share with them. Don't know
Mhm.
what exactly you have going on, but I once struggled with, and talk,
Mhm.
that just opens the door. Just that people are typically looking for a place of comfort, and it
Yes.
does sadden me that oftentimes when people come, it's not that they didn't want help, they just didn't know how to find a soft enough spot or a way to navigate through people and circumstances and just a complicated system to find a place that's soft enough. So to hear you even say that, it just makes just my clinician spirit just like yay, because you know Billy can't be everywhere at all times.
No, she
I
cannot.
can't. Veronica can't. But we all are somewhere all the
Mhm.
time. So if
Right.
we just start with those individuals
Absolutely.
with compassion, I feel like that right there would be a game changer.
Mhm.
Compassion.
Yeah, it really is. First of all,
Absolutely.
you have so much to be proud of, and you should be proud of yourself.
Yes.
Absolutely.
But yeah, I think the beautiful insight from my perspective is having an awareness of what is happening with you just
Mhm.
automatically gives you greater awareness of the world around you, and
Mhm.
really feeds that empathy that we should all be functioning
Mhm.
in life with, right? Like nobody knows
Mhm.
what everybody else is going through, and we should all just
Right.
be kind and hope that we can be helpful in some way if we can. So this leads very nicely into the next topic, which is around the community. So we've touched on it a bit already, but
Mhm.
in your experience, how do family dynamics, community support systems, and cultural expectations shape the way Black individuals approach mental health care? Billy, what do you think?
Family dynamic is huge. I have definitely seen that in my career working with children and their families. Um, Having the permission of the elders for the Black community specifically is huge. Like I just shared, my uncle was the one that said to me, "Hey, I think you might need to go, and talk to somebody because that's a lot what you just went through." And what I found for me, that did give me permission. I wasn't thinking about therapy, to be honest. I thought, push through that whole thing that we have.
Like,
But it gave me what I needed to be able to do that. And I think that that is huge. With the work that I do, we find that there are a lot of grandparents raising their grandchildren. There are a lot of aunts and uncles raising their nieces and nephews. And for them, like we said earlier, it's therapy is new. Therapy is the unknown. It's the big thing to fear. But giving young people permission to say that it's okay, I'll support you. I'm here. I'll even go with you. That is huge for a young person. And I can't say enough how young people come out on the other side thanking that elder for giving them that permission to be free in that space, and how important their support is. As far as community, a lot of our football coaches, a lot of our librarians and school teachers and soccer coaches play a big role in that family dynamic as well, whether they believe their family to these young people or not, they are. They spend quite a bit of time with you and you become that extension of their immediate family. So that support is important to know that we can talk about my therapy session here at school today if I had a bad practice. Coaches get a lot of earful and information about what's going on inside of a home, sometimes more than they care to know. But because they care about that young person, they're willing to come to me and say, "Hey, Ms. Edwards, she kind of shared this. I still hold her trust, but this is what you may want to ask her, or this is how you may want to approach him to get a different answer, to know what is going on, to share with the therapist what they need to deal with." So it's huge. The elder community is huge. Cultural and community impact is huge, giving our young people and sometimes their parents permission to be free in that space and explore therapy and not be stigmatized, with some of the other misconceptions that we named earlier in the conversation. So it's very important.
Thank you. Teresa, what about you?
I agree. I actually just believe that in our communities, in our homes, wherever our feet happen to pass, it's an opportunity. Um, I see the challenges, that people that even want to help in the schools and in the community, resources are so limited. Sometimes people don't want to open up the dialogue because they don't know what to do with the information. There may not be someone readily available to pass that on. So I think that in our communities, in our homes, in our churches, everywhere that we are, it affords us an opportunity to just step closer and closer to just the topic. I think I shared with you ladies that a few weeks ago was the first time that I personally had ever been in a church. It wasn't my own, but in a church where the person delivering the message actually used the words, "I have a therapist, I have depression, I take psychiatric medication." That was huge. It was just huge. So I think that, again, if we just all start using our little circles of influence to talk about the topic, to not overlook people, to have that level of awareness and sensitivity and kindness. Time is not always on our side, but sometimes it just takes just a few minutes just to stop and recognize and see in someone else what you recognized in yourself at one point. And so I think that we have a lot of opportunities in our community, in our homes, to start networking and knowing not just what to do, but how to help people get to where they need to be.
Mhm.
Just like we would do if it was a muscle or a bone or just, we
Mhm.
know those resources. We know where to go.
Yeah. Michelle, what about you?
So I agree with both of the ladies. One thing I want to kind of piggyback on from Billy is if I don't know if we can do this, but if we can change the older generation of the thought process behind the seeking therapy, seeking medical help for the things that we could change,
Mhm.
then we could then start breaking those generational, thought processes going forward.
Mhm.
So if you can't, it's important, in my opinion, that you block some of
Mhm.
those lovingly, block some of those ideas so that we can change the path forward. Because what you will, my thoughts are, if you welcome, I know it's really hard because of our past when it comes to doctors and all of that. I know it's hard, but we can look at our history and then also understand that there are changes that have been made for us. And I know one thing is it's very hard to find therapists who may look like us. However, all there, if you can't, there's still other options. But when you decide that you are going to have a lot of your issues and challenges addressed, the outcome, in my opinion, would be astonishing. You have children who are getting into trouble, and it's all in, I'm not saying throw medication on kids immediately and all of that, but some of these kids are getting into trouble because they don't know any other outlet.
It's very true.
So let's talk to these kids and see what's going on. If you open up, if you show that this is something that is normal, just like you're going to the pediatrician, like you're going to the dentist, I understand that we're going to need to talk about a few things. So if we normalize this, I really feel that we could change generations of in the Black community. I'm the one who gets really excited every time I see someone do what we would think is extraordinary. Hey, we had twin valedictorians in college that were Black, and yes, it's some of those things. Like if you see a Black pilot, and you're like, well, okay, other nationalities don't think that because it's the norm for them. When are we going to start seeing us in positions where you do not see us currently as the norm? So it starts with getting the care that we need for our children. Make sure that we're taking care of ourselves, because you can't take care of yourself. You can't take care of them if you're not taking care of yourself. Taking care of ourselves to take care of our children, who will take care of their children, to advance us in the community and show ourselves for who we are. We are truly our ancestors' wildest dreams. And they have done so much to get us in these places, but we can't get there if we're just depending on some of the things that are not connecting us, where, mentally, emotionally, and all of that. But if we get that help that we need, it'll help bring us forward.
Right.
Absolutely. I think one point that was made when we first spoke before having this live conversation that I noted and want to make note here is having a mental health issue is not a character flaw. This is not a morality thing. People struggle, like we talked about before. If your pancreas was struggling, who's you blaming about that one? Come on.
Right.
Endocrinologist.
So you get it taken care of.
Yeah.
Pancreas. So we are running short on time, so I'm going to skip a little bit to the end of what we had gone through initially. And the one question before we close is, can you describe how you think improving mental health would positively impact the overall well-being in the Black community? And Teresa, let's start with you on that one.
I think that it would improve in every area. I don't think that we can, in the Black community, I don't think that we can afford to continue not adequately addressing the mental health issues. I agree with Michelle and Billy on everything that's been said. I think that addressing those things early on, very early, should become the norm. Yeah, just the impact. When I look at patients and how seeking mental health changes their lives, and typically, even though Michelle said we want to take care of ourselves so we can take care of our children, oftentimes it's the other way around, that people will come and see about their children and then later recognize that, oh, okay, maybe may have gotten some of those ways from me, or just some of those things. So I think that in the Black community, in every way, it would benefit us to look out for each other, look out for ourselves, become our brother's keepers, our neighbors' keepers. I don't see any way that it couldn't help us. And again, I just want to emphasize that I just don't feel like we could afford to continue not addressing the issues.
Billy, what do you think?
I think that I agree with Teresa, but I think that to Teresa's point earlier, we can't do this work alone. When she mentioned that, you know, the three of us can't be everywhere, so we do need everybody's help. And I think one of the biggest components that we didn't talk about today, because we're short on time, is that we do need the church. Black people, we love church, we love God, and we love Jesus. And the church is very good about advocating on other issues, but they forget about the mind. I feel we're supposed to love God with all our heart, with all our mind, with all of our soul. But if my mind isn't healthy, I can't serve. I can't be whole. I've heard a minister say there's nothing wrong with prayer and a pill and going to see a therapist. All of those things will work together, but you have to work them. So I think that we need the help of the church. That is a tremendous staple in our community that needs to address Black health. Just as Teresa said, she heard for the first time in the church a minister standing at the pulpit being fully transparent about his mental health issues. We don't know who was in that congregation and who was ministered to, and in that moment got a little piece of freedom, because if he's flawed, because I saw him as perfect before he opened his mouth, but now I know he's flawed in the same way that I am, and he's still okay. So let me go find somebody that I can talk to so I can eventually be okay. So I think that if we partner in a different way, in a better way with the church, continue to incorporate our other community advocates, such as coaches and teachers and neighbors, just as Teresa just suggested, the Black community has no bounds. If we're mentally healthy, we can do anything, and we can achieve anything, even in a even greater way than we are now, if our minds are healed from whatever past trauma we have, whatever secondary trauma that we have. And yes, that starts with parents and caregivers. They tell us on the airplane, put your mask on first,
Right,
before you help your neighbor. And that is so very important, because I wouldn't be able to participate in this conversation today, I don't feel fully, and not be able to share my own story. Because people will oftentimes say, well, you don't have kids, you don't get it, you don't know. And that's okay, I'll give you that. But for this side of therapy, yes, Ms. Edwards has been to therapy. I know what that is. Let's talk about it. So I think that we need to be more transparent, more open, more honest about our journeys, and share. And just to continue to incorporate all of these other community agencies, like I said, the church, football, coaches, teachers, neighbors. We need everybody's help. We can't do this work alone. But just know that when you jump in and do the work, it's going to call for you to be transparent and honest about your own journey. And that's okay. We still need you to be in the game with us. So we definitely can do more.
Yes, thank you for that reminder. And I remember you also saying, an easy way for a church to even start with this is at
Mhm.
health fairs, have a mental health care professional there.
Yeah.
So people at least have that access to be able to have
Mhm.
conversation and ask
Yeah.
obvious questions. So
Yeah.
thank you
Absolutely.
so much
Because
for,
because the health fairs are good. We address women and their breast cancer. We give out shots for the flu and COVID. But what if I just thought about harming myself this morning before I got here to set up the health fair? We don't have anybody for that,
right.
and it doesn't need to be, all out loud and all of those things. You can still do some of those things that I suggested earlier. Walk around the campus of the church, have a meeting in a separate area, just one-on-one. You can find a way to do it discreetly, but just know that the church body is also suffering from mental health issues as well.
Yes, they're everywhere.
Mhm.
Michelle, what about you?
Well, I feel like I answered it in the last question, but I just want to say that everything that Billy and Teresa said was spot on, and I feel like if we get it addressed in the Black community, you're looking at being more progressive in academic, emotionally. Our communities would be stronger financially. Can you imagine? I mean, financially, economically, there is no, just like Teresa said, there is no corner that you would not touch
Right.
if we were more open and ready to address some of these, very deep rooted issues that have been put
Mhm.
in us since my great 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 grandmother until now, unless we get those addressed and start moving the needle forward. So I believe that there's no limit to
Right.
um, where the Black community could go if we just stop to be more accepting to addressing our mental health and bring mental wealth to our community.
Very well said. And, obviously this has been a very rich conversation. We did have other questions we didn't get a chance to get to, but I do want to just share my screen one last time to share some resources if you are interested in learning more. There are obviously organizations, but also so if you're seeking help, if you're interested in learning more about specific tools that can be used with the Black community, you can go to any of these organizations' websites, and they do have information to share. I'm just going to leave that up for a moment so that if anybody wanted to make note of anything, they could. But the second slide I will share here is a list of podcasts. So such a rich conversation, and you could hear many, many more about them. So the Black and Well podcast focuses on wellness, self-care, and mental health, offering tools and strategies for Black individuals. The Black Mental Health podcast hosts discussions on mental health, wellness, and self-care, highlighting Black experiences and perspectives. Melanated Mental Health podcast explores mental health, identity, and cultural experiences through personal stories and expert insights. Therapy for Black Girls podcast provides practical mental health advice, personal stories, and discussions on issues affecting Black women specifically. And The Unspoken Truth is honest conversations about mental health, trauma, and personal growth in the Black community. So really great opportunities to learn more, be exposed to more of what is actually being experienced by this community out there, and dig into this topic a little deeper. So with that, I just want to say a final thank you to each of our lovely panel members for this incredibly thoughtful discussion. And thank you all for being here today. I hope you have gotten a lot out of this conversation, and maybe refer other friends to come and view it and learn all that they can. And subscribe to the YouTube channel, because you just get more cool content like this on a semi-monthly basis. So thank you, everyone. I really appreciate your time and having this conversation with you. It's been an honor.
Thank you.
Thank you.